Good afternoon, all. This is the Health in the Public Interest Wednesday seminar series. The Health in the Public Interest program at Georgetown is a one-year MS directed by Adrian Fu Berman and myself. And we feature seminar speakers each week. We hope that if this is your first time, you'll come back again because they're always great. And today's seminar is going to be no exception. We'll have a formal introduction in a minute, but I just want to take a minute to just really point out that Lynette Golding has been a real asset as a faculty member of this program, teaching the health communications course for several years now and taking part in all of the real basic activities of the program, including offering up suggestions for seminar speakers. And for example, last year, I think four or five, in the last year, four or five, six of the speakers have been people that she suggested. So we really do appreciate everything that Lynette does. And it's also something we try to do to feature some of our faculty as seminar speakers so that you all get to know who's behind this whole program. It's not just me. It's not just me and Adrian and Jenny. It's a whole group of faculty members. So, the Health in the Public Interest Program is a program that emphasizes the social determinants of health, the non-clinical things that affect health and healthcare. And we'll have our URL in the in the chat box. And any of you, if you want to learn more about the program, are welcome to look at our website or to look at one of our information sessions. You can see when they take place by following our website. So without any further ado, we're going to turn it over to Kaylin, who is the student moderator today, and she's going to um, introduce Lynette, followed by around a 45-minute talk. Lynette may pause to involve people or not, but after the whole thing's done, we'll have until possibly as late as 1:15 to field questions, first from the students and then from the broader audience, moderated again by Kaylin. So let's hear the introduction. Kaylin Walker, please.
Sure. Good afternoon, everyone. Thank you for joining us on this rainy day. As Dr. Myers mentioned, my name is Kaylin Walker. I am a current student in the HAPI program, and it is my pleasure to introduce Dr. Lenette Golding. So, Dr. Lenette Golding's work bridges research, practice, and teaching to improve public health outcomes through effective health communication. Dr. Golding believes that successful health communication involves not only sharing information, but actively listening, collaboratively creating solutions, and strengthening individuals' and communities' capacity to make informed choices that enhance well-being. With extensive experience across diverse communities, she develops tailored social and behavior change interventions that resonate with local needs. Her professional background includes designing and evaluating health communication programs in low and middle income countries, with a particular focus on maternal and child health. Dr. Lenette is more dedicated than ever to advancing health communication as both a science and a practice, aiming to amplify community voices, promote equity, and provide clear and accurate information. And a fun fact about Dr. Golding is that she loves qualitative research because it reminds her that people are beautifully unpredictable. So, if there are no further questions, I will pass it over to Dr. Golding.
Thank you so much for that warm welcome, Adam and Caitlin. It is indeed a pleasure to be here, and I see some of my friends and colleagues online, so thanks for joining. And Jennifer, if you can cue up the slides, that would be great. Uh, yeah, so I'm just going to start this by saying if you take anything away from this talk, I want you to remember that you have the power to be the antidote to misinformation. By learning how to identify false narratives and responding with clear and accurate information in accessible language, you can really strengthen trust in public health. And we all have a really important role to play in our communities. That said, now let's face reality. We are living in challenging times, especially here in the United States. the rise of the internet and social media platforms and AI have all drastically accelerated the speed of both information and misinformation. You'll remember during the COVID-19 pandemic, misinformation flourished online, really dividing the nation and eroding trust in government and scientific institutions and mass media, and really making the fight against misinformation even more challenging. And I was so delighted and excited to be invited to speak as part of this seminar series. Research reveals that when individuals learn about the tactics used by those who spread false information and the motivations behind them, they can become empowered to resist that misinformation. And moreover, as an educator, I really feel it's my duty to inspire critical thinking and intellectual curiosity about human decision making, behavior, and psychology of risk and misinformation. As a professor, it's my responsibility to engage students in thinking critically rather than simply instructing them on, what to think. So, next slide, Jennifer. This seminar also is providing me a chance to address some of my concerns regarding the recent developments in the field of public health, and in particular, what is happening at the Centers for Disease Control and Prevention, also known as the CDC. The direction that this administration is taking is deeply troubling to me as a public health professional. In a recent conversation I had with a friend who previously worked at the CDC, she prompted me to review the updated CDC priorities page, and you'll see that here on the screen. And I wanted to share some of my observations with you. One, I noticed that the term gold appears frequently, and I'm guessing it's suggesting a focus on enhancing the agency's image. I'm not sure, but it did stand out. And while the term evidence is referenced multiple times, it really raises questions as to some well-supported interventions, such as harm reduction strategies for opioid overdoses and housing initiatives aimed at improving health outcomes. Those seem to be overlooked completely. Additionally, the page restricts CDC scientists from investigating health disparities affecting minority populations. And notably, there are 3 leading causes of death in the United States: cancer, heart disease, and accidents. They're not mentioned at all, nor are critical contributing factors such as tobacco use or nutrition or physical inactivity. Actions speak louder than words. And for instance, the recent actions taken by the CDC's Advisory Committee on Immunization Practices may provide some insight into how the agency is evolving. It appears that the current approach the Secretary of Health and Human Services involves denying certain facts, redirecting attention from significant issues, and really undermining the established public health safeguards. And these trends are alarming to me because they're most likely going to have broader implications, including a decline in public trust in health organizations, challenges in effective public health communication, disparities in health outcomes across different populations, among other things. So it's crucial for us to continue discussing these matters to promote public health for all. Next slide, Jennifer. And then there's another example I wanted to share with you. Jennifer's getting the slide.
Sorry, it keeps linking me to the CDC page.
Oh no, yeah. Well, I'll just go on and you can catch up. There you go. You've probably seen this. It's a recent instance of disinformation that involves claims made by Mr. Trump and Mr. Kennedy regarding the relationship between acetaminophen and autism in children born to mothers who took the medication during pregnancy. These assertions really contradict a robust body of scientific research, which has consistently found no significant link between acetaminophen and autism. So it's really troubling to me to see that some information on government websites are not fully aligned with established scientific evidence. So that was another reason I'm glad to be here. Next slide. So I have one more bummer slide before I shift gears. And you're probably at this seminar because you most likely believe this, that misinformation is evolving into a very serious challenge that requires our attention and proactive strategies. This phenomenon often involves polarizing messages that can create divisions among communities, as well as the influence of unqualified individuals who spread false claims, stir up emotions, and promote conspiracy theories. Unlike accurate information, false claims can be more compelling because they tend to be sensational and easily shareable. And this places a significant demand on checkers. Ooh, that's a hard one to say. Checkers to uncover the truth and provide clear evidence to refute misleading statements. The ongoing nature of this work really highlights the importance of dedication and persistence in combating misinformation. And as the saying goes, a lie is halfway around the world before the truth has its boots on. It really illustrates the challenge we face as the principle of BS asymmetry, or also known as Brandolini's law, reminds us that casting doubt is much easier than dispelling it. In the realm of public health, we're engaged in two crucial battles: addressing disease and overcoming disbelief. And health communication professionals, and I dare say all of you, have a vital role, especially now that some protections offered by big tech have been reduced. And so this is where we all come in. Next slide. I know it's really easy to feel down in these times, and I often feel discouraged and anxious and angry and frustrated, and typically all at once. Yet when those feelings arise, I remember the words of Hans Rosling. He was a Swedish statistician, doctor, and a very engaging mathematics communicator. He said, "Things can be bad and getting better." And I actually have this quote written on a sticky on my computer. See, here it is. And it reminds me that overall the world is improving despite the challenges we face. In these times of misinformation, Rosling really stands as a beacon of truth. And so while it might seem delusional to maintain hope in the current political climate in the US, we do have more tools at our disposal to connect with people than ever before. And the emergence of direct-to-audience marketing channels such as social media, email, texting, and the growth of user-generated and user-owned content have really transformed the landscape. These channels not only enable us to reach a wider audience directly, but they also allow us to track and measure our impact more effectively. And collaborating with trusted messengers and influencers really provides yet another way to make our messages more relatable, credible, and likely to stand out amidst all the noise. And additionally, and maybe more importantly, we possess the knowledge to make diseases less deadly. So I hope that was a bit uplifting. Next slide, Jennifer. All right, so let's dive into the topic of misinformation. And this refers to information that's false or partially inaccurate or misleading. We're going to examine, with the time remaining, examine really the reasons behind the rise in misinformation, the tactics used to spread it, and the actions we can all take to help reduce its prevalence. As Sir Mark Wolpert said, he was an English medical scientist. He states, "Science isn't finished until it's communicated." So, although people are vulnerable to misinformation, that we have a lot of opportunities to combat it. Next slide. And we need to think like one of my public health heroes, Dr. William Fagey. He developed the surveillance and containment strategy known as ring vaccination for eradication of smallpox. And this method involved isolating cases of disease and vaccinating their contacts to break the chain of transmission. And he designed this approach to address limited vaccine supplies. This strategy played a very pivotal role in the later stages of the global smallpox eradication campaign and ultimately led to the successful eradication of the disease. But I want you to think of it this way. Say you have a family member and they're telling you about some misinformation they read on X. Maybe it's your uncle, right? And to apply the ring or the vaccine ring strategy to misinformation, you must identify the patient zero. In this case, your uncle, right? The source of this piece of misinformation, he's spreading it. He's listening or he's reading stuff on X, and now it's up to you to help provide that accurate information to the source's most immediate followers and connections. Maybe this might be your other family members. Thanksgiving's coming up. You could be in this scenario. The goal is really to build a ring of credible information around the source, preventing those falsehoods from spreading further. Now, this contrasts with mass vaccination approach, right? Where resources are spent correcting information on a broad, untargeted scale. We know that that's really hard to do with limited resources. Next slide, please. But let's just back up for a second and discuss why people spread misinformation. They really do it for a mix of psychological and social and structural reasons. And it's not always with bad intentions, although I will say that money and power often drive the purveyors of misinformation. But on a not so nefarious side, sharing information, even false information, can signal a group membership or loyalty. Maybe you're loyal to a particular political identity. Misinformation can also go viral because it's novel or dramatic or aligns with trending narratives, and it gives sharers social visibility. Ironically, people also sometimes spread misinformation to help others, such as warning them about, supposed health risks. And then there is the structural and media environment factors. The modern spread of misinformation is fueled by a larger crisis in trust in authoritative institutions and also amplified by algorithms of social media. Social media platforms often reward engagement, not accuracy. So emotional or sensational content tends to spread faster. And as we saw during the COVID-19 pandemic, misinformation fills the void when clear and timely or culturally relevant communication is missing. And then there is strategic manipulation. Some actors will intentionally create. Sorry, my dog is coughing. Some actors will intentionally create and really spread false information for political or economic or ideological gain. And I didn't know this but someone told me that there's a market for disinformation as a service. You know, bad actors can actually buy malicious campaigns with little effort. So, and misinformation spreads too because clickbait and fake news sites, they profit. They profit from engagement, even when spreading harmful health and misinformation. So, next slide, please. And then because we're human, there's cognitive biases. These are automatic and unconscious types of thinking that tend to result in beliefs that conflict with reality. And there's hundreds of cognitive biases. But here's just three of them that are important when thinking about ways to address misinformation. One is confirmation bias, right? And this really describes our tendency to select information that confirms with our existing beliefs. Conversely, when we encounter information that contradicts what we want to believe, we tend to, swipe past it and ignore it. Confirmation bias is something our brains do. It's just how we're hardwired. We're already biased towards information that we want to see, but the algorithms that social media uses and that we use to search for information today are also geared towards reinforcing the things we believe. So it's really a double whammy. And then there's a bias, that has to do with our emotions. When messages provoke fear or anger or even hope, people are more likely to remember and share it, regardless of the accuracy. And then there's cognitive overload. In this fast-moving information environment that we all live in, people really rely on gut reactions instead of critical evaluation. Next slide, please. So let's just talk about some common tactics used by people who spread misinformation. And most recently, we have seen purveyors of misinformation cherry picking data, So for instance, numerous sources have accused RFK Jr. of cherry picking data to support his positions on vaccines. This includes citing flawed studies while ignoring established scientific consensus, misrepresenting findings, and selectively highlighting specific data points out of context. Misinformers have also doctored images. You may have heard about Trump sharing a fabricated video on Truth Social promoting med beds. These are non-existent medical technology that conspiracy theorists believe can miraculously cure any disease. The video, it's taken down now, but the video depicted a fake Fox News segment in which a robotic-sounding Laura Trump announced that every American will soon receive their own MedBed card. Right? So that also leads me to tell you about how people like to tout miracle cures. Like you'll remember during the COVID-19 pandemic, early into it, ivermectin, which is an anti-parasitic drug, which at the beginning, of COVID-19, we were scrambling for information on what could be done. But ivermectin was being promoted as a miracle drug to treat or prevent COVID-19, despite the lack of scientific evidence and warnings from public health authorities not to take it. We're emotional creatures more so than rational creatures. And so misinformers often use emotional language to evoke fear or outrage. And so, rhetoric from anti-vaccine groups frequently will use terms like medical freedom or personal choice to suggest that vaccine mandates are unacceptable, government overreach, right? And then, of course, conspiracy theories are a major tactic. to explain complex events. This strategy often involves casting doubt on legitimate individuals or institutions. And of course, one of my favorite conspiracy theories from COVID-19 pandemic days is that, vaccines are just a way for billionaires to track us with their microchip vaccines. Wait, what is that, Bill Gates? What is that? What are you saying? Oh, right. I should tell them vaccine skepticism in the US kills more children outside the US because it transfers that skepticism, right? Thanks, Bill. Thanks. Right. Another tactic of misinformers is to spread false experts and sources. Spreading false information may involve fabricating new content or misrepresenting existing information using made-up visuals or data or sources to appear credible. Like back in May of this year, a report from RFK Jr.'s Make America Healthy Again commission cited non-existent studies on mental illness and children's asthma medication. So another real popular tactic is to discredit someone. So remember when Dr. Fauci, who actually spoke in the seminar series, I think last year, he served as director of the National Institute of Allergy and Infectious Diseases and became the face of the US government's COVID-19 response. Yet he got attacked over and over and over again. Efforts to discredit him have included congressional inquiries by the House Republicans, being grilled over public health guidance, and then there's the right-wing media commentators like Tucker Carlson, who accused him of a wide range of misdeeds and having, using a lot of misleading and false information, really to attack his character, right? So all these are tactics. There's a lot more of them, but these are some of the most popular ones. And I bet if you looked on social media right now, well, don't do it while I'm talking, but if you looked on social media, you would probably, well, maybe not, because the algorithm might not work, but maybe it would. You'd encounter some of these. Just turn on the news. All right. Next slide, though. So I just want to talk about digital media because social media and online retail sites and search engines, they're all primary channels where public health misinformation spreads most easily. And these platforms facilitate the rapid dissemination of false information because they're so easy. The ease of content, it can be shared and it can be manipulated so easily. But we have to remember that social media platforms can also be crucial to the successes and failures of public health communication, right? So here's an example of one such failure, and it's vaping, right? So tobacco-related content, including promotional materials and misinformation, it's really prevalent on social media. And research shows that exposure to this content, it doubles the likelihood of tobacco use, especially among young people, right? So most teens use social media and have a smartphone, and nearly half of them are online almost consistently, according to a new Pew Research Center survey of US teens from ages 13 to 17 that was conducted around this time last year, right? So that's a lot, a lot of kids with eyes on screen. Now, the tobacco industry knows this, and they employ strategies like Twitter bombing, where multiple accounts flood conversations with similar messages. And another tactic is called astroturfing, which disguises paid messages as grassroots content. And these tactics create a false sense of consensus. And really then, of course, targeted messaging is used towards specific demographics It's just to further enhance their influence. Um, so the good, bad, and the ugly of social media. Next slide. So I have to mix the bummer news with the good news. So here's the good news, right? So what can you do? What can you as a person individually do? It's probably more than you think. So research has shown that when people perceive the environment as chaotic and dangerous or unpredictable, they often turn to their local community for social support, safety, and a sense of control. Um, in August of 2025, the KFF tracking poll on health information and trust indicated that most adults are skeptical of the health information and advice they see across social media platforms. But in an earlier tracking poll from January this year, it indicated that most adults will trust their own doctor the most, right? So they look to the people that they know that are part of their life. Now, with that is the caveat that, it's important to note that not everyone has a doctor. And additionally, there are some groups of individuals who have experienced historical discrimination and abuse and have less trust in the health system. So, uh, but doctors can be an important source of information. Local TV is also tends to be more trusted. Uh, so people turn to their community, the people that are in their lives, the environment that they know, right? So that's where you come in. Um, and next slide, please. Yeah. So, rather than chasing lies and really trying to persuade people who have already been convinced by them, researchers and public health officials are now exploring ways to get ahead of those lies through social psychology tool called pre-bunking. And pre-bunking highlights the tactics used to spread misinformation. It primes people not to be fooled by bad information. And you could say this seminar is a pre-bunking session, right? You can use pre-bunking to really fill in knowledge gaps and address confusion. And now the idea of pre-bunking can be traced to a social psychologist back in the 1960s named William McGuire. Dr. William McGuire, he was inspired by how vaccines teach the body to fend off disease, right? And he argued that attitude inoculation, also called the theory of psychological immunization, it could really build up a person's resistance to a persuasive but flawed idea by exposing them to, weaker versions of that same idea that they could learn to disarm. And so, fast forward 5 decades later, and another social psychologist named Sander van der Leiden, he stumbled across McGuire's research in a library while exploring ways to snuff out misinformation on climate change. And rather than squander limited resources on endless rounds of whack-a-mole, van der Leiden said McGuire's idea about neutralizing bad information before it spreads seemed even more relevant now, especially in the digital age. So some advantages to pre-bunking include that it taps into people's innate desire to not be manipulated. We don't like that. And the other advantage is that it can be apolitical. You can be apolitical when addressing misleading narratives or techniques. You can just by merely pointing out how people are trying to fool you. Dr. Van der Leiden has really captured the public's imagination in a way that few others have, probably because the concept of pre-bunking, it's seductively simple. But it's definitely one that's gotten a tactic that has gotten a lot of attention. All right, next slide. So, so here's an example of how you could use pre-bunking. Say you're with your uncle at Thanksgiving, right? And he is telling you that COVID-19 vaccines were approved way too quickly without any proper safety checks. You get into that conversation with him, right? And so he's not ever going to get vaccinated. You've heard this from him now for many years, and you've had numerous conversations with him now for many years. But using kind of the pre-bunking tactic, you could explain the misinformation tactic that people are using to spread this misinformation. There's been false experts in data, there's been emotional manipulation, there's been political polarization and rhetoric. And then you can clarify that the speed of vaccine approval was due to increased funding. Lots and lots of money got poured into that. And clinical trial efficiency, uh, you know, it was there as well. It didn't compromise the safety, right? So by telling your uncle about how he's been manipulated would be a way that you could pre-bunk. Although in this case, that information's been out there for a while, so maybe it's not really pre-bunking. It's more of maybe the next slide. Yeah, it's more of debunking the falsehoods, right? Or fact checking. And in this case, with debunking, you're really educating people about news sources, trustworthiness, or reminding people periodically to consider what they're reading. It might be false. So you would use debunking to directly address false claims and deceptive tactics while also highlighting accurate information. Now, cognitive psychology shows us that people often remember the first thing they hear. So you want to start off with a fact if you're using this method. Some people refer to debunking as a truth sandwich, right? So you start with a fact. Oh, I guess it would be this piece of bread. You wouldn't start with the top. You start with your piece of bread, right? You start with that fact and you identify the false claim. And then you explain why it's wrong. And then you end with another fact, right? So you're putting the ingredients of the sandwich between those two facts. That's why they call it a truth sandwich. So for instance, say your uncle is telling you that he's not going to get a COVID vaccine because he doesn't want to be microchipped, right? Uh, so here's how you could use debunking on that. You could say something like, uh, COVID vaccines are made only with ingredients that help the body recognize and clear out that virus that causes COVID-19, right? It is a myth that COVID vaccines have microchips that track your location or movement. I mean, just think about it. The needles that you would, use for vaccines injections are way too small to allow a microchip to pass through. The smallest microchips are about the size of a grain of rice and would also require an accompanying antenna. Yeah, right? That's much larger than the vaccine needles that are used. So inserting an object would be extremely painful and obvious because there would be a wire. Uncle, vaccines are just liquid biological materials and they don't contain any devices. It would be impossible to have them there. So that would be, a possible scenario and how you would use that debunking method. Now, I'll just say fact checking and debunking they're not risk-free. Research suggests that misinformed people are least likely to benefit from fact checking, especially when they're so confident that they might be right. And trying to prove a belief wrong can really invite someone to become even more deeply entrenched into their side of an issue. Also, debunking and pre-bunking, it relies on people who already trust the source, right? So if people think that the World Health Organization is anti-American, or Dr. Fauci is corrupt, or that Bill Gates is evil, then elevating an alternative source, it's not going to matter much. It just makes people think that the platform is colluding with that source. Plus, the efforts require far more time than it takes for a person to crank out disinformation about vaccine safety, right? That quote about a lie can travel the world before the truth has its boots on, right? So the race to protect the truth can feel like a losing one. And the COVID-19 pandemic really has shown the costs of sitting idle and letting things go unchecked. And this is why, being that local source, you're trusted in your community. People know you, they trust you, and that's why you're so important in all this, right? But next slide. So, there are some basic tenets in health and crisis communication. One, I just kind of did a little pre-shadowing there, is time is of the essence. The longer that misinformation sits in people's brains, the more entangled it becomes. And you always want to start with your key message. You always want to start with that key message. I did that with you today. The key message is that you can be the antidote here, right? You also, as I've said, a trusted local community organization that's doing great work. That's where the trust is right now. People are turning to people they know in their daily lives. Healthcare providers, local news, trusted messengers. They don't have to be experts in a particular health issue. You don't have to be an infectious disease expert. You just have to have some kind of rapport with the audience. And we know this to be true because of the success of social influencers, right? And if any of you have been in my class or will be in my class, you know that I will say this over and over and over again, is that you have to know your audience. This is key. And we talk about this a lot in my course. You have to understand the social norms and the biases and the attitudes and the behaviors your audience are influenced by. You have to, knowing those things can only make your communications more memorable and actionable. And so, it's not because people are crazy or stupid. They all have reasons to believe the things that they do. And it's really because we rely on different informational sources. So if we're going to crawl back from what's been said about public health, we're going to have to build trust. And so that means that we have to understand our audience. You also have to make your content approachable, and you can do this by using plain language and not using jargon and technical terms like antigen and herd immunity. People also don't make people do math, right? So, for instance, like 40% of US adults don't always wash their hands after using the bathroom, right? Instead of saying something like that, you can say something like, use smaller numbers that people understand, right? 2 out of 5 people you shake hands with may not have washed their hands between using the toilet and shaking hands with you. So think about that the next time you go to a meeting. 2 out of 5 people, right? Yuck. So, and some folks too, will say we need to advocate with social media companies to have those checks. The thing is that social media, there's little incentive for those companies to police content if it means removing users or advertising dollars from their bottom line. So that strategy, that's why it's not working so well. All right. And also, as a public health communicator, this goes for everything. It's okay to say, I don't know. especially if there's uncertainty around the topic, like there was with COVID-19. You can follow that up with something like, uh, you know, I don't know, but credible information can be found, and this is a evolving issue. But what is clear right now is X, Y, and Z, right? Or I understand your concern, but what we know is X, Y, and Z. And I tend to start a lot of conversations by saying, when I'm say talking to my uncle, right, and who's you know, has some conspiracy theories in his head. I'm so interested. Oh, that sounded fake. You know, I'm interested in what you believe. Tell me more about that. Or, um, you know, if something like, well, tell me why you believe that, or where did you hear about that, or or saying something like, oh, that's interesting. Why do you think that, or doing saying things like that. It's a more compassionate way of listening and signaling that you genuinely want to understand where they're coming from. So having that empathy. All right, I'm wrapping up because I know I'm cognizant of time. Next slide. So I'd be amiss if I didn't share some resources, and there's a ton of resources on misinformation if you're interested in this. You'll see on the left bottom side of the screen there's these videos. There's 5 videos, in fact. Van der Leiden and his colleagues over at Cambridge University and the University of Bristol, and also I think Google, they created these 5 videos, which inoculates people against a particular manipulation tactic or misleading rhetorical device commonly encountered online. Those are really interesting to watch. The infodemiology.com site, they have live dashboards and track trending online health conversations. They also have a practical training on misinformation and other resources, so you might check that out. And then the Public Health Communications Collaborative website, you can download different talking points and timely resources. They also have a review of misinformation alerts, and these alerts are based on monitoring of publicly available media data from diverse sources, so social media and news sites and blogs and forums and videos, all those things. And what's cool is that these dashboards automatically update every 15 minutes and display information from the past 30 days. And they're aggregated by the national and regional level. And then there's the KFF surveys that I talked about, referenced rather. And it's a collection of research and public opinion polls that they've conducted. KFF is an independent health policy research organization, and these surveys cover a wide array of topics related to health and healthcare policy in the United States. So you might check those out. And they do it, I'll say on a nonpartisan basis. All right, next slide. Now I'm trying to hurry. The last thing I wanted this is a fun thing to play. It's called the Bad News Game. It was launched in 2018. By the University of Cambridge. Again, Van der Leiden was there, and he had some help by some other colleagues too. But the cool thing about this game is that it primes people's ability to spot misinformation by offering a glimpse into what motivates someone to spread falsehoods in the first place. So as the player, you pretend to be disinformation and fake news tycoon who is then invited to smear the government or mainstream media on Twitter, and each tweet earns more followers and grows influence. And the game really coaches the player to build their fake news empire by creating fake official Twitter accounts for themselves and impersonating a famous person and launching a news site or all this stuff, right? So it points out how all this works. And research has shown that it really does increase people's ability to spot misinformation techniques. So take a look at that. And then last slide. I just wanted to thank you all for joining the seminar today, and also thank you for all that you do to protect public health. And with that, we can open it up for questions.
Thank you, Dr. Golding, on that wonderful presentation. So we're going to have a little bit of time for questions. We're going to start with my colleagues in the HAPI program, and then we will move to taking questions from the general public. So we can go ahead and start with June.
Hi, thank you so much for your presentation. It was so incredible, and I really did learn a lot. And I feel like it's very applicable and useful skills, especially right now. I was just wondering how we could use like PSA and public health campaigns to kind of like pull back the curtain on a lot of what we do in order to kind of like get into that pre-bunking kind of before again before it's happening, like sort of showing everyone how this process works beforehand and like kind of when is that useful and when is it too late to get into that.
Yeah, that's great. June, you might take a look at those 5 videos that I referenced as kind of a source of inspiration because they go through each tactic one by one. But if you wanted to create like a little video, a short video, say for social media or something like that, you could take little snippets and as a pre-bunking, say, this is what's happening, this is how it works. Again, going on that, you know, we as emotional people, we don't want to be manipulated. We don't at all. And in fact, in social psychology, the word persuasion, they call it the P word, like the F word, they call it the P word because people just don't like to be manipulated. So take a look at those videos.
Thank you.
I don't know if that answered your question, but yeah,
No.
you're welcome.
My colleague Noah also had put in the chat, I can go ahead and read it. She said that we've talked in some of our classes about direct-to-consumer advertising and how it's somewhat of an invasive way for manufacturers and corporations to infiltrate people's media consumption. Do you ever see that there's ever a world where this type of direct-to-consumer advertising in the healthcare space can be ethical in prioritizing patients over profit? Or does the nature of direct-to-consumer advertising at its core make this an unrealistic goal?
Uh, yeah, you know, unfortunately, capitalism, the name of the game is making money. That's the society that we live in. I think it is possible, of course, anything's possible. But, companies want to sell their products. So that's going to be their first priority, unfortunately. Yeah. Anything else?
I also did kind of have a question. I know that we talked a little bit about debunking some of these studies and kind of how to frame our information in a way that's understandable for the general public, but do you have any insight as to where we kind of draw that line in making information readily available and kind of oversimplifying information to where we're not really getting the point across as to how impactful a policy or a health issue could be to the general public? Like, where do we kind of make sure that we're not oversimplifying our information?
Right. Well, that's a great question. That's what conspiracy theories do. They oversimplify a very complex issue. If you give me a moment, my battery's about to die and I have to change locations. Just hold on a second. Sorry. Hold that thought.
While Annette's moving, I just want to say that I'm in the midst of planning the seminar series for next semester. So if any of you have ideas for topics or speakers, please feel free to pass them on to the program or to me, myersa@georgetown.edu, myersa@georgetown.edu. I can't promise that I can arrange for your suggestion to be active to result in a speaker for this program, but I will certainly look at it carefully and many suggestions that people make actually do turn into seminars. So thanks for being part of all of this. And here's Lynette again.
Yeah, sorry about that. That darn battery. But back to using simplified. I don't think see it as using simplified language. I see it as being a clear communicator. And if you're really trying to make a point, you know, using numbers, making people do math, using jargon, really can really just destroy your efforts. So why not make things clear? You know, if you are talking about a complex issue, you can highlight why it's so complex, right? Like autism, complex, very complex. But they're trying to simplify it into saying, oh, it's acetaminophen, right? Which is bunk. So, yeah, clear communication, not rather than simple communication.
Perfect. I'll go ahead and take another question from the chat. They're asking, how do you apply the debunking approach on conspiracy arguments in Africa regarding GMO, looking at the African experience?
Yeah, it's just it would be the same way that you would do it anywhere. You could talk about all the different ways that and tactics that people use. And I just named a few. These are six of the chapters, but within those six chapters in this that guide I was telling you about, right? The impersonation, the emotional manipulation, the polarization, the conspiracy theories, the false experts and sources, the discrediting. I mean, those are the main tactics. So, with pre-bunking, you're telling people how they're being fooled. You're pointing out, you're making the people spreading this information look like, well, you're calling them out. You're calling them out on the manipulation. So that would work no matter where you are, because those are the same tactics that are going to be used in Abuja, Nigeria, as they are here in Washington, D.C. So yeah, people don't like to be fooled. So tell them how they are being fooled.
It looks like Dr. Fu Berman also has a question.
Mhm.
Yeah, more a comment actually, having exactly to do what you just said, Lynette, about people not liking to be fooled. So Farmed Out did a presentation called Why Lunch Matters that covered some social psychology things, but also just used all these examples. Our audience was physicians and medical students, but used all these examples of how they were being fooled, and it had a really emotional impact. The on physicians who they had really emotional reactions to it, but really appropriate reactions. It was such a good way to get them to stop seeing drug reps and stop going to industry dinners because they didn't like being fools and they really wanted to do the best things for their patients. So it's like it's so important showing people the different ways that they can be fooled. So that's just really important. So thank you. It's a great presentation.
You're so welcome. Yeah, I see Gerard. Am I saying your name right? Bismois?
Yes, it's
Yes.
actually Géraud.
Giroux, French. Okay. That's a great question. I think I always start with empathy and listening. Beginning conversations by listening to understand and not only respond, right? That is that old saying of we have two ears and one mouth for a reason, right? So it's those empathetic communications. It really can show an awareness and consideration of your audience's emotions and their beliefs and their fears. Um, I think that's a good place to start being relatable, uh, trying to explain complex scientific information can be challenging, but trying to use, analogies and stories that can help you make you be more relatable. And the other thing I want to stress in all this is you want to address is the tricky thing. You want to address but not repeat that false information, right? You want to correct the false narratives without repeating them. So you can do this by providing evidence-based guidance. You can explain the origins, say, of vaccine myths or whatever other myths. And you can highlight benefits and safety about doing a behavior. And you always want to amplify um, experts that are respected in that community, right? If there are some. And also offer additional resources. I know if you're talking about, religious community, there's a lot of things in the Bible and the Quran. All those books have some health, especially the Quran has a lot of health information in it. Yeah. So yeah, the ethical line between persuasion and coercion, I think doing more listening than talking and being honest with people, that's what it's about. Yeah. Adam, you have your hand up.
Yeah, I just had a comment, and I'm interested in what you have to say about this, which is that, you have cases where, Uncle Albert just misinformed, and, we can work
Mhm.
these tactics. But there's a lot of people out there that basically um, get into all of these false ideas and claims because really it's something else that's bothering them, right? It's like poverty, it's like
Mhm.
oppression, it's like their own racism or racism against them or nativism or fear of unknown or fear of the
Here.
future. And
Mhm.
what do we do about that? I mean, in one sense, it's almost hopeless, right? Are you talking to somebody that like, no matter what you say, it's like, Big Brother is out to get you and da 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 da, da, and
Yeah.
they don't believe it themselves half the time. They just, that's what satisfies their need to complain against the system or the man. So, your comment, please.
Yeah. Again, having empathy and listening is always the place where I start from, and realizing that, people aren't stupid and foolish, even if what they're saying you don't agree with and you kind of think it is kind of stupid and foolish, right? Um, I think uh, we all have these cognitive biases that we are fighting against. All of us do. All of us are under the confirmation bias. You, me, everyone in this webinar. When we encounter information that contradicts what we want to believe, we tend to dismiss it and dig into it, right? There's a lot of it's called cognitive dissonance, right? That icky feeling like, oh, I might be wrong. So, it's not, I don't have a simple thing that you can say or a quick fix on that. It really is, if you know the person, if it is your uncle, you might have the luxury to spend time with them. If it's the general public, you just have to keep hitting home with empathetic messages. Yeah, yeah. Your poverty can tear someone down in countless ways. And there are resources in the community that you can use to help alleviate, food insecurity or lack of health care. So pointing people in places might help. I don't know that I answered your question.
Yes, you certainly did. And I just one quick comment by me, which is that there's something in human nature that wants to believe in weirdness and unknown and something in the beyond, right? And with Halloween coming up, it's all flourishing. But we all are thrilled by movies like Close Encounters or whatever, and these kind of ideas that there's something spooky out there. And we all don't want to be Ghostbusters. We want to believe in that stuff. So
Yeah.
anyway,
Yeah, I mean, and I think that is, again, it's coming from that fear. It's the fear of the unknown. I see my colleague here just in Nigeria that I worked with on a nutrition campaign. Uh, he's talking about polio eradication in Nigeria. I know when we were working on that nutrition campaign together, we encountered a lot of it's just a belief in God, and God will provide you with what you need, and God has the answer, and whatever. So sometimes God didn't do that. Sometimes God does bad things. All these things would come up in conversations. Um, the reality is that all of the public health problems are a mixture of social, structural, behavioral problems, and it's not you can't just fix one thing, and you have to fix it all at the same time. Um, and so I think getting to your comment, AK, that poor public health and international donor bias towards major health priorities in these countries is a real issue, and it's one that we've been working on for a long time. Yeah, I don't know that I answered your question on that one either. You're welcome, Carolyn. Thanks for coming. I see so many of my old colleagues that came. Thank you. Anything else?
I think we have time for maybe one more question. I'll read Kate's question here in the chat. She was asking, when dealing with folks who have no interest in connecting, is there a way to include personal quotes or stories to help debunk false information or beliefs?
Yeah, absolutely. Stories are great, and we are storytelling animals, and we like to uh, even if you don't have connection with the real world, you do look at your phone, and more than likely you're watching videos with stories in them. In fact, this administration is more and more using videos with a story format. In fact, I was approached by a reporter yesterday that sent me like 5 different videos that the administration has put out, all in story format, right? And stories are great because Jerome, I think it's Jerome Butler, Dr. Jerome Butler, he said the great thing about stories is that it makes people think, right? Perceive, feel, and think all at the same time. Stories are great, and you can spark parasocial relationships with story characters. In every story, you're going to have a protagonist and an antagonist. You're going to be looking at people's behavior. So stories are definitely a great way to go.
All right. Well, if there are no further questions, thank you, Dr. Golding, for such an amazing presentation. This recording will be available if anyone wants to go back and reference it. But other than that, I hope everyone has an amazing rest of your day. Stay dry with the rain today. And thank you, everyone, for coming.
Thank you.
Thank you, everyone. Thank you so much, Lynette.
You're welcome. Bye now.